anyone who doesn't know me, the Nat and Rob show, so for Nat Cook sitting down the front here, please tune into that. So we've now been doing that. We're in maybe our 4th year now, and that's the most amount of fun I think I've ever had in my working life. So wellbeing, can I just pass that to you? Thank you, I don't need that. Thank you, I don't move around. Defined by the WHO as the complete state of physical, mental and social well-being, and not just the absence of disease. So who feels in this complete state of wellness at all times? The research says that there's not many of us, and it's certainly not me. The problem is that we have to solve this. Specifically, we are working on obesity, chronic disease and equity. They are 3 huge and wicked issues. We are a part of Queensland Government and we're very, very small, but we do work very closely with our wonderful partners at SportTech Health, and I'm not just saying that because we've got SportTech here, absolutely amazing to work with. Health, communities, human rights, Mental Health Commission, the University of Queensland, QUT as well, and industry as well as the arts as well. We have been set up so differently. So now you're probably sitting there going, so what's health got to do with the arts, and what's health got to do with sleep? What's health got to do with communities? It's got absolutely everything to do with it, because everything that affects health the most sits outside of health. It's just that health gets the benefits. So we cannot wait another 20 years for us to get sicker. We know that. We've got an amazing health system here, but we have to actually help and support them because they have an enormous job. We all need to stay well and stay at home as well. And it's not just about drugs and it's not just about treatments. It's actually about being physically well, mentally well, socially well, financially well, and engaging with our communities and feeling a part of that as well. I believe that the work that Health and Wellbeing Queensland actually does can actually change the lives of all of us. And we began now the beginning of 2020 and we have got off to a fantastic start. I would like to acknowledge the traditional owners of the land on which we meet today and pay my respects to elders past, present and emerging. Our vision is big, so it's not just about obesity, it's not just about chronic disease. It's actually about the next generation of kids. And who doesn't want to get that right? Well, I am here today to say we have to get it right. But to do that, we've got to partner, we've got to create, and we've got to innovate. So within a government department, we've got to create and we've got to be exceptionally different as well. We need each and every single one of you. So we've actually got to work together to solve these issues. So I have been a part of health for around about the past 25 years, and I've learned everything of what not to do. And it's certainly to not work on your own, because it never, ever works. So we will do this by using evidence. So we've got our own amazing research team. We are going to be doing things differently. So, you know, saying things like, are we just doing this because we've always done that before? And that catches me every time because I've been around for so long as well. I think, so why are we actually doing it? Stop, Rob, and think, why are you actually doing it? And often the answer is yes. So by long-term planning, it's not a single overnight solution as well. By investing in things that actually work, and we understand the things that work and we know the things that don't. By leaning into things that are coming as well. So things like the wellbeing economy, the data piece, research and climate change. And there's so much there that we can do in sports and health and tech, etc. And by knowing what it won't be. And it's not going to be more of the same. It cannot be through those really short-term spends, and it can't be without measurement. Every single thing we do, we have to measure and we have to prove the worth. This is public money. So that's our, what's our why? So late last year, Health and Wellbeing Queensland announced that for babies born in 2023, will actually live a shorter life than their parents. So that is the first time ever that we have seen that in this country, and I think we were the first who reported it as well in November. So for First Nations kids, that is so much worse. So we are actually widening the gap. So further, we know, number one in two adults, so one in two of us, maybe not this group, 1 in 2 of us have at least one chronic disease. Most of us have more than one. Number 2, we know that 97% of our kids, and this includes mine, do not eat enough veggies. 97%. So who are the 3% that are? We know that 1 in 3 kids don't get enough sleep on school nights. We know that a third of all kids don't adhere to screen time, and I'm going to talk a little bit about that as well by showing you a screen. And then 1 in 6 kids are already living in poverty. 1 in 6. We know that 1 in 4 kids are overweight or obese, and now it's about 27.5%. So thinking about me back at school, it was around about 1 in 100. So now it's 27.4%. And we know that in the north of the state, 1 in 3 homes don't have enough food to last a day. So did you all know that? Did you all know how? So that's hard to hear. So what about physical activity? We know that 1 in 2 adults don't get enough physical activity, and what's worse is that 1 in 3 kids don't. How is that possible? For me, I grew up in Sunnybank, and there were bikes and running and farms and creeks, and I did everything wrong. It was sort of dawn to dusk every day, and I did not stop moving. The kids of today don't move. So, if you remember nothing else about today, remember this. So this is the first time that we have shown this in Queensland. Basically, for those living in Brisbane, the median age of death is 82 years. So for me, I live in Toowong. It's fine. That's pretty good. Went out to Roma a little while ago, and they were very, very sad to hear that it was about 70 out there. You go to some parts of the far north, the further you get from the city, get up to the far north, there's a 31-year gap. So the median age of death in the far north is 51 years. 51, I'm 50. I was going to say 51, but I'm 50. So there's so many reasons for this. So this is because we are remote, we are vast. This is because of difficulty for access to services, access to support, access to help, access to sport, cost of living as well. It's been incredibly hard over the past decade. Over the past year, it's getting even worse. Farming, floods, there's so many things that are going on at the moment. So the numbers here, I'm so concerned. I'm so concerned for us. I'm so concerned for us in the north. But the thing that keeps me up at night is that most of this is actually preventable. Obesity, chronic disease, and equity. So we've got a really large remit because really there's nothing there that doesn't fit. There's never going to be a single thing that's going to fix this. So, first of all, we've got to use incredibly strong legislation, and that's the L word, and we have to actually use it. And I cannot bear to hear us about the nanny state. We have to actually be strong, and we've got to look after each other. Number 2, we've got to have really strong partnerships, like really, really great, like Nicole and Elia and Nat, Hops, can I call him that now? Hops and I as well. We've got to actually work together. Tiani as well, I didn't name. By really, really strong academic partnerships, and Glenn here today cannot wait to do more with you. Through co-design with consumers, so actually asking them what do they want, not just what they need. So I guess that for me, going in for 25 years and saying, do you know what, you're going to have to eat a little bit more and you're going to have to do better and you're going to have to eat your veggies and things, they hate that. And people know that, by the way. You ask them, what do they actually want? Geez, it makes a difference. Through data as well, so knowing the right things for the right communities at the right time, through understanding what do they need and what do they want, and they want cost effective, they want simple as well, because life is hard enough. So to have an app and you've got to get in again and you've got to think your password again. You know, my mother phones me 15 times a day, Rob, what's my password to this? I think, oh my goodness, I just can't even. So life is exceptionally hard at the moment, and we've got to make it so much easier. And Judy here is going to come and talk about some of the things that we are actually doing at the moment, and things that we have planned as well. And then I'm going to show you some of the fun stuff as well at the end. Thanks, Judy.
Thank you, Robyn, and thanks, Nick. And it's a pleasure to be here with Robyn. I'm her Senior Director in her team, and I particularly have been leading some work to develop Queensland's response to the National Obesity Strategy over the last year, and I just want to reflect a little bit on that for you. I wanted to share with you first just some insight in particular about when we have looked at some monthly WAVE survey data from 500 Queenslanders, what the insights they gave us and what they were looking for. And they were looking for a good routine and to be more active and actually enjoy what they were doing. They were looking for something to assist them with time and in their busy schedules. And it needed to be something that wasn't a drain on their finances. So that's really sounding like tech solutions to us, and we absolutely recognise that. I wanted to highlight that when we have talked to people about what they can do to improve their health, they very often talk about walking and how that's something that's really accessible for them, and they want to be able to walk, and it's absolutely so much benefit to their health, but there's still a lot of barriers. And in particular, for people aged over the age of 45, and I'm in that cohort, and particularly as a woman, I identify with this, I don't feel safe to walk on my own at night time. So that limits my time that I'm able to get out and be active. And we really do need to create all of those connection points to enable people to feel safe and to have very flat, connected, safe pathways to walk on. And then that's really going to increase their likelihood that they will. With respect to technology, during our consultation on the strategy is going to be called Making Healthy Happen. Please remember that name. I hope it's currently before Cabinet for consideration. Yes. We actually consulted with just close to 1,300 individuals and organisations through 3 rounds of consultation over the last 12 months. That included a lot of people who are living with overweight and obesity, and we really used that to inform the development of the strategy. We really want to hear what Queensland felt was really important to them and what they want to see as change over the next decade. And what was just fascinating, I just loved to hear it, is that, and as we went through the consultations, it didn't come up in consultation round 1, but it did in 2 and 3. Yay, technology, we have to embrace technology. And I recall a meeting I had with Nat and Nick, and I think you were the first to put it out to us during the consultation period. And people are really, they were saying, you absolutely do need to embrace this. And so we're adopted it as one of 6 guiding principles in our strategy. And it needs to underpin what we do going forward over the next 10 years. And that could mean anything from further cutting edge technology around personal health monitoring and devices. It could be an AI coach online to assist you with your goal setting and to motivate and encourage you. And we're just, I see that there's so much available now and developing and emerging that is going to assist people to really be able to put their health to the forefront. And we're really excited to be embarking on this, and we need the input of all the people in the room here to help us to deliver that and provide that as really accessible options for everyone in Queensland. And I also just want to emphasise our partnership with the Department of Tourism, Innovation and Sport around ActiveKit. We've been so pleased to partner with the department. There's been 2 rounds of ActiveKit funding that has been delivered across the state so far to 39 innovators in the first round and 25 innovators so far in round 2. And I know that there's some of you in the room who have received this funding and have had initiatives underway. Just some examples with Tennis Queensland, the Click to Connect program, which actually looked at, for the first time, getting the online booking system to connect people and be able to get easier access to courts. I mean, that's a great use of technology and getting people playing more tennis. And I love the Scenic Brim, the Empower Her program as well, absolutely utilise technology to get more women walking together and hiking, just fabulous. So those are just 2 examples, but I'm going to hand back to Robyn, and she's going to show you one of our really exciting programs that is going to be launched very soon. So you're seeing a sneak peek. Thank you.
Thanks, Judy. Thanks, Judy. Okay, so I think you're going to have to help me with how we do this. So this was built from a very strong partnership between QPAC, Health and Wellbeing Queensland, the University of Queensland, and Children's Health Queensland as well. So this is health, art, sport, and this is about move, sleep and eat as well. So a decade ago, I've been in paediatrics now for a long time, there was nowhere for anybody to just kind of go to find out a little bit more around sleep, a little bit more around the things that they should do to eat, sleep and move. So we brought in the doctors, brought in allied health, ex-phys, physiotherapists, the nurses, I'm trying to think who else, the teachers, consumers, families from across the state as well, and just designed this together. So kids, I did not like the name. Kids love the name, so there was different names, and they apparently I'm not cool. So Pod Squad was it, and that's fine, even though I still hate it. So they chose the characters, the colours, the games, and it's fun. And now I've got it on my phone and I play it all the time and I can't stop, so I'm not quite sure it's that good at getting us off a screen, but it shows you how. So this is a screen reminding kids to get off screen. So I'm just going to play a little bit for you.
Wonderful. And now we present for your viewing pleasure this bat thing.
EpiPod.
Wearing a hat of some sort.
Helmet. Watch me work it. Sitting isn't fitting when there's fun out to be had. And slouching on the couching is particularly sad. It's no surprise that standing still will leave you feeling flat. And if you move your muscles, you will soon discover that a bouncy ball was made to bounce, a slide made to be slid, a rocking horse was made to rock, and a kid was made to kid.
This is a range of games. This can go on for hours. So there is a range of games. There's 42 characters. I don't know what they're called, epipods, and you've got to grow the home tree. Anyway, they say that it's fun, and it is fun. So this is coming. We hope that this is going to be in every GP office. It is at the moment. I think it's just about there starts in July, and every school. So this can be amazing. So we are so excited about this. So my last slide is just as a leader within Queensland Government, I can honestly say the leadership now in government is right. I've got to say the capability of all of you is completely right, and there is a focus on equity as well, which I absolutely love. So I just need you to sign up to our newsletters, to be a part of Active Kit, to know so much more about us, because we've got to change things, and it's just going to take every single piece of every single one of us to do that. Thank you.